physical therapist and clinical director for
Therapydia.
Therapydia,
Yeah.
thank you, Portland. 2009, he graduated with a doctorate in physical therapy from Pacific University. Following graduation, he entered the Kaiser Permanente Hayward PT Fellowship, and in 2012 earned his fellow status with the American Academy of Orthopedic Manual Physical Therapists. Josh is also a board-certified orthopedic clinical specialist with the APTA and a level 1 certified functional movement systems clinician. In addition to the secondary education in orthopedic sports medicine and manual therapy, he's also a CrossFit level 1 trainer. He's an active member of the OPTA and the APTA. And I went a little bit out of order. Just remind you guys, I know you've all heard this, but cell phones off. Make sure you grab the course eval. That's how you get credit for coming and hearing Josh. So if you want to drop those off, you guys can try to figure that out at the registration desk when you're finished today. And then also, Jeremy asked to remind, or just to request for you guys, if anybody wants to carpool or is willing to take people to pub night, 5:10, 5:15, you can meet at the registration desk, and we can kind of connect together to drive over there. So please help me welcome Josh.
Thanks. Well, thank you for that nice introduction. We're all about data, and we want the best possible data to make sure that our application of whatever we happen to be doing with our patients is most effective. And I think CrossFit has really heard the medical community in that fashion, and so they're doing a lot of clinical trials right now. They're using hamsters, so bear in mind this is preliminary data, but they're trying to look at the effectiveness of using the wheel in a team format type of workout. And you guys will get a first glimpse of this coming from headquarters. So now the partner WOD starts. But you got to keep going. Don't stop. And it's all for time, so keep going. Go, 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 go. That's not really data coming from headquarters. I made that up. But I'm sure if we were to talk about CrossFit, that might be something that we would conjure up in our head, right? Some hamsters running on a wheel, one falls off, so be it. It's a body on the floor. I'm going to hurdle it, step over it, step on it. Doesn't matter. I got to get through this workout. I changed the title. Obviously, this is not what you guys originally saw. Some slides have been shifted around a little bit. Nothing as far as the depth of the content is really any different. But the title changed because I heard a speech by Greg Glassman, who I'll introduce here in a second, and he called CrossFit a juggernaut. And so if we think about kind of the definition of a juggernaut, it's obviously got a tremendous amount of momentum with really nothing that's going to be able to stop it. That's the perception that some people have of this concept of CrossFit. So really what my goal is, what I would like to do, and I'll talk about it in my objectives, but I'm really just want to give you guys some background information, some detailed information that pertains to what is being taught in the certifications, where my background comes from as far as my involvement within CrossFit, but most importantly, hopefully to give you guys some real tangible knowledge, some tangible information that you guys can walk away with to understand more about what CrossFit is, comparative to some of those awesome YouTube videos that I'm sure we have all seen, okay? How many here have heard of CrossFit before today? Very good. How many here have done a CrossFit workout? And how many here are actively in a CrossFit box or a gym? And I'll raise my hand because I am. Okay, very cool. So I got a great introduction. I don't have to go into any more detail about that. These are my two kids. I do have to introduce them. Alec and Ella is the little baby girl there. I do more than have a clinical practice here in Portland. I teach a little bit with Pacific University. I work with Mark Pro, which is a recovery unit as part of their resiliency project. I work with Scora, which is a minimalist shoe company here in Portland, and then I also contribute a little bit of articles from time to time to the Tabata Times. And it's a resource that's really well known within the CrossFit community, but I think it gives a lot of great information for all types of athletes in their different training arenas. So the question always comes down to then, what is truly CrossFit? And I love this slide because it does highlight some of the different things as far as that we can kind of think about, or at least the way in which we're perceived as CrossFitters, or the way in which we perceive people that do CrossFit. So top left here, a scene from 300. This is typically what our friends think. Some step aerobics, that's what mom thinks. Society thinks, and you can't see it, sorry, the hands are really bloody, so it's a torn hand. This is what other CrossFitters think I do. They just kind of slug it out, work through it. This gentleman here is the 3-time CrossFit champion, so this is basically what I think that I do. I perform at his level. And in actuality, I just get smoked every day, and that's when I lay on the floor. But that's not really true. So this could be CrossFit, just the same as this could be CrossFit. And we'll talk a little bit about that. And again, I have some personal bias, and I'll disclose that. But the question really is then, what is CrossFit? And we'll get into the very technical definition as far as how CrossFit defines themselves. And then hopefully we can elaborate and collaborate to come up with a definition that maybe suits the way in which we've been perceiving or seeing it with those things in mind. So for full disclosure, I train at CrossFit Portland. I've been training there for about a year now. And I go to a whole bunch of CrossFit events as a vendor, as a sponsor, and I work with these athletes in between their events and in between their heats. I see quite a few CrossFit athletes exclusively in our clinic, and I've sponsored quite a few CrossFit athletes as well. So that is obviously something that could be a bias, but when we talk about this information and the questions that I want you guys to present to me, no bias at all involved. I will be probably one of the first people to stand up and criticize some of the things that we see, just the same as I would also be able to defend it based upon my experience and what I've done. So we're not going to drink any Kool-Aid today. There's no recruitment to my cult. So we're going to talk a little bit about outlining kind of the history of CrossFit. We'll define what is a CrossFit athlete. We'll also give you a little bit of an information on how CrossFit defines itself. Talk a little bit about the level 1 cert that I've gone through. We'll give you guys some background information. I'll give you guys some background information on the lingo, the terms that you're constantly hearing coming from CrossFit athletes so that you have a better way to communicate more effectively, whether it's with the athlete themselves, with the coach, or just to understand a little bit more about things that you might hear or read. And then that'll also lead us into being able to have some more effective communication strategies so that we're able to continue to do what we do as clinicians. Okay? So a little bit of a history. This gentleman here is Greg Glassman. He's kind of the founder, founded CrossFit out of his garage in San Francisco, California, or excuse me, Santa Cruz, California. The first affiliate was kind of brought up in about 1995. So CrossFit's been around much longer than what we've probably seen. It's had, substantial growth over the past 3 to 4 years. Obviously, we're seeing it now on regular ESPN instead of some obscure ESPN. So it's there, it's more in our face. We're seeing it more and more people are participating in it. As an organization, as an industry, it was established in 2000. And currently, the approximate number is right around 9,000 affiliates. And those are the individual gyms that you'll see. And with about 10 million athletes participating. And it doesn't obviously mean that they're all in one of those particular affiliates. People can participate on their own. And I'll talk a little bit about how people might not actually be in a CrossFit gym, but doing CrossFit just the same. So this is showing through the graph what some of the exponential growth has been within the affiliates over time. So you can see right around the period of about 2010, some substantial growth up to now, and it's still growing, just not growing at these exponential rates. So a little bit of the history, and I'll get into the terms as far as defining what the CrossFit Games are, regionals, those types of things in a moment. But 2007 had their first CrossFit Games held, like 70 athletes, some field, some kind of open barned area. They had a hopper, which is literally they spun it like it was bingo, and they started pulling out workouts and then shouted them out, 3, 2, 1, people went and off they went. In 2011, they developed a way in which to actually be more systematic in who they can have come to the games, which is more the world games, so to speak, and they developed the CrossFit Open. So everybody in the world can participate in the Open, sign up, then you're going to go ahead and, based upon your performance, be asked to come down and go into regionals, which then gets you selected down into the games. This year, most recently, so it went from, in 2011, about 26,000 people participated in the CrossFit Open to 138,000 this last year. So in 2 years, you're seeing some substantial growth, okay? And that's the history of it. Pretty simple. So the CrossFit athlete. This is how they define a CrossFit athlete. This is off the CrossFit Trainer's Guide. The person who is trained and skilled in strength, power, balance, and agility, flexibility, and endurance. think it's pretty basics, pretty comfortable as far as the definition. Doesn't say that they need to be puking in the corner. Doesn't mean that they have to have torn up hands, that they have to have a herniated disc. So the way in which they define it is looking at somebody who's pretty well balanced. But in actuality, we are the CrossFit athletes. Anyone in here, anybody in here could be a CrossFit athlete. And you might not want to call yourself that as an athlete. You might not define yourself as that. But the walks of life that come in and out of a CrossFit gym are just as diverse as you will see in any other sport. Okay? So we've got a lot of working professionals, moms, dads, grandmas, grandpas. You're looking at people that are former high school and collegiate, even professional athletes looking for an outlet, getting a little bit more of that excitement about coming into the gym, having a little bit of that competitive edge. Tactical athletes are people that are extremely supported and supportive in the CrossFit world. So firefighters, police, military personnel especially. They are obviously really well supported, and we'll talk a little bit about that when we get into some of the other lingo. And then there are now starting to become progressively more and more professional athletes that are exclusively CrossFitters. Have you guys heard of the National Pro Fitness League? Couple? So very similar to the NFL and a lot of other things, they're developing a league where these athletes come, they participate, and they're selected and drafted into these different regions to represent teams that they'll go and they'll compete. So right now as it stands, the CrossFit Games, CrossFit as a corporation is the only place that they can go off and have some of these big payouts for competing in their particular event. The National Pro Fitness League hopes to change that and give these men and women an opportunity to devote a little bit more time to their training, to their craft, and then at the same time actually maybe be a little bit more sustainable, as opposed to some folks who are retiring for a year and saying this next year I devote myself to this particular sport or this particular concept of getting to regionals and then getting to the games. So this is all, it's kind of an intermediary for that, but also at the same time it might be something that people that can't get to the games because there's a ton of great athletes out there, another outlet, another place for them to be. So in the definition of CrossFit, the way in which they define it is to forge a broad, general, and inclusive fitness. And then the way in which they develop that is through constantly varied, high intensity, functional movements. And then within the methodology of it, they're going to be using these various types of ways in which they're going to be getting at that. Okay, everything from diet to using some gymnastic-based stuff, which might be biased because Greg Glassman was a gymnast, but when you look at some of the body weight movements, they're categorized as gymnastic movements, and then also looking at weightlifting and throwing. So CrossFit, in the process of its certification, they've discussed different ways in which they look at how they're going to develop some of their fitness standards, and they've got 3 different ways. So the first one is the 10 general physical skills, and it's everything from cardiovascular and respiratory endurance all the way down to accuracy and agility. The other thing that they're looking to hopefully develop or utilize in this concept of developing these fitness standards or within the development of their programming is the Hopper model, and I talked about it as far as when they were selecting these random exercises and kind of putting them out there within the 2007 original games. But really what they're doing is they're developing programming, or they're looking at ways in which they can develop fitness that lets you work on developing the things that you know that you might have to encounter, the known unknowns, and then the unknown unknowns. So just being prepared basically for anything is the way in which the Hopper model can kind of be conceptualized now. So it's not random, willy-nilly, I'm just going to do this, I'm going to do that, but they want you to look at having enough variety, enough versatility within you and your performance as an individual. And then they also talk about the way in which they tap into that through the 3 metabolic pathways, okay? So short, medium, and long term. Any questions about that stuff? Okay. As questions do come up, if they're kind of beyond the scope of this, I will just say that's beyond the scope of this, but I'll try and answer it as best as possible. Okay. So we're going to talk a little bit about the certification process. It's a 2-day cert. They talk about the 3 pillars of any type of movement within this 2-day period of time. So they're talking about orthopedic safety, which you guys should put a smile on your face. Orthopedic safety, they talk about it. Talk about functionality, they talk about mechanical advantage. So they're looking at the ways in which to basically do the most amount of work possible, as safely as possible. Now, what ends up sometimes happening is while we teach and tell you to do something, the way in which that's interpreted and applied can be totally different, right? And that's where we can run into problems. And that's no different than anything we've all seen within our own profession. We've gone to a Con Ed class or a certification course. We've heard what they've said, but then we'll watch and we'll see people do stuff that's the exact opposite of what they've taught. or completely different, still thinking that they're doing what was originally taught. So it gets lost a little bit, and I think that's where some of the challenges come as far as from a certification point of view. And then they also talk about recognizing here are some of the major movement errors that we might see within an individual, and here are some of the potential causes. All right. So within this 2-day certification course, you're going to go through these 9 elements or these 9 movements. So it starts with a squat, press, and deadlift. Those are the 3 kind of pillars of the foundations. And then those are broken out into 3 different ones. Air squat, front squat, overhead squat. And then within the pressing, it's shoulder press, push, jerk. And then the deadlift is deadlift, sumo deadlift, high pull, and a medicine ball clean. So those would be the 9 movements that they'll really kind of capitalize on teaching over the course of the 2 days. And also within that period of time, we'll talk a little bit about nutrition. It's not paleo. They don't promote paleo. They talk more a little bit about zone, but most importantly, they talk about quality over anything else. Eat clean, have clean living, and then moving into things like supplementation and hydration, with no specifics within supplementation, just talking about concepts of it. They'll also bring in elements of rest and recovery, and then also a little bit of program development. Believe it or not, within the CrossFit cert, they talk about having people come in about 3 days at a maximum, for the most part. As you start dealing with more and more elite level athletes that are going to be going over 2, 3, sometimes 4-day competitions, where they're doing 2, 3, sometimes 4 events in a particular day, the training regimen needs to change. But that's for a very select few. So even within the certification process, they're still trying to get people to recognize that you don't need a ton of time in the gym to have some of these long-term benefits. High intensity interval training, the benefit is that we see some elevation within basal metabolic rate over a 24, 40-hour period of time. And so using some of these concepts, which are implemented in CrossFit, is kind of the idea too. Plus they recognize the physiological stresses and strains and things like that too.
Question.
Yeah.
Why is the paleo diet totally attached to the CrossFit program?
That's beyond the scope of this conversation. I couldn't tell you why they chose to do it originally. I don't know who or how it kind of became intertwined. If there's somebody in here that does know, by all means, you're more than welcome to speak up. I think as it kind of came out for the concepts of clean living and cutting out carbs, this, that, and the other thing, but what they were finding is that athletes were crashing. They needed to have certain levels of carbohydrates within their diet to perform and continue to perform at this level. And I don't know, that's all I can tell you. Because I know that I have a coach that writes individual programming for some elite level athletes, and he and I have had great conversations about this, and he's talking about concepts of if you want to perform and perform at this level, if you want to compete over 3 days doing 9 different events, and you're not going to have any type of carbohydrate within your body, you're most likely going to completely crap out at some point in time. Right? Or you're not going to be able to continue your training regimen at a high enough intensity to perform well because your body doesn't have enough to refuel over the course of your training time. So I don't know how it came to be that the paleo diet was kind of tacked on, at least originally, but what was interesting, I think it was about a year ago, they had all the CrossFit athletes at the CrossFit Games sitting in a room, and I think it was a pretty informal Q&A, and they said, of all the athletes here, raise your hand if you do paleo, and not one of them raised their hand. And so I think while some will kind of chant a little bit more about paleo, when you look at what's actually applied and what's actually done, the vast majority of them aren't doing that. Okay.
It seems like that's an unfortunate interpretation of what paleo is all about, because it's not a meat-based diet. It's actually strongly advocates eating locally produced foods that are seasonal. Mm-hmm. And meat might be a part of that, but there is no carb-cutting guidelines in the book that say you should specifically cut carbohydrates out of your diet.
Right, and so a bastardized version of what the paleo diet probably was just got thrown in there, and and that's where people were just like, the caveman and just eating meat all the time, and I'll grab a handful of nuts and some veggies, and that's kind of where it spun to, and it can spiral out of control based upon, at least from what I've seen, based upon certain groups and the way in which they blog, who blogs what, who talks about what, people latch onto it and kind of moves forward in that general direction. So, but that would be no different than what we've seen in other things that we might not necessarily agree with or that aren't really well founded because they are misinterpreted along the way, right? All right. So following the certification, the programming, the development of their business practice, if they choose to develop an affiliate, it's entirely up to the box. It's entirely up into that gym owner, up to that actual individual trainer, okay? So not all gyms will have the same programming. And this is very important, and I'll say it again, not all gyms will have the same programming. So if you run into a situation where you're listening to a patient or a client or an athlete talk about what they do at their particular gym, that represents that particular gym. It doesn't represent everybody, it doesn't represent CrossFit as a whole, okay? So what I'm seeing a lot more is that people are starting to look at a little bit more of their programming and starting to develop it a little bit more uniquely based upon the clientele that they have. And they're starting to develop a little bit more uniquely based upon the individual goals that those particular athletes will have. So they might do individual programming, or they'll be looking at it over a longer term period of time, not just this hopper model of grabbing a couple of exercises and seeing if they can have everybody exhausted on the floor at the end of the day, okay? So high variability between different locations. And then there's going to be high level variability between coaches. So I went to a 2-day cert, and I met a handful of people that were former trainers. I was the only physical therapist there, but then some other people had some anatomy and biomechanical background. Somebody was an engineer. Somebody had, and another person had absolutely no concepts really about CrossFit. They had maybe done it a couple of times and were doing the cert. And that's not to say that they're going to go off and they're going to open their own affiliate, which is really all you need to do is have your level 1 and you can open your own affiliate. But it also does show you that there's going to be varying backgrounds of individuals that are going to be teaching this stuff. And that can be part of the criticism and the concern. But at the same time, we should also understand that, you know, CrossFit, as far as the certification process is, they're growing, they're learning, and they're trying to change it to really help the industry itself. Okay? And then after the level 1, like I said, it really is up to the individual as far as what they want to be doing and what their background is. But there are different levels of certifications that you can continue to go on and do. There's a trainer's prep course where you can actually learn how to be an even more efficient coach in an attempt to maybe actually go out and teach for CrossFit. But then you can also go off and do some individual certifications, whether it's going to be based on endurance, football, there's some powerlifting, and running is another one, the endurance one, and mobility is a big one too. All right? Yeah?
Do you know if there's much of a difference between the CrossFit level 1 certification and then a certified personal trainer as far as requirements, or are CrossFit level 1, are they personal trainers? They don't get that.
They're personal trainers within CrossFit.
Right.
Right? So the question was, is there a difference between personal trainer and a level 1 CrossFit coach? I was a personal trainer for a while, and the education system is different. Like mine had a lot more anatomical and biomechanical background. It's through the National Academy of Sports Medicine. I spoke with a group of trainers on Thursday, the National Personal Trainers Institute. They do a lot of background, and it's a lot longer process for them, whereas this is just a 2-day cert. And so what they're implementing within the 2-day certification is they're implementing more the model, the concepts that CrossFit has as a whole, comparative to looking at some of the biological systems, the anatomical considerations and things like that that we would know from our background or that some other type of institution might do. There are a lot of CrossFit level 1 coaches that do one-on-one coaching, right? So they might come in and have some one-on-one personal training sessions that they would do. So again, you know, the personal training field as a whole doesn't have a significant amount of regulation to it. But I think in general, everybody is trying to at least develop some concept of some fundamental stuff. But this is going to be different than that as far as the cert is concerned. Good question, though. Any questions on the cert? Okay. Fun stuff, the lingo. This is half the fun of being a CrossFitter. You get to use really cool words and wear really fun stuff. So CrossFit has what's known as main site. People will be like, did you run the workout on main site on Thursday? And it's just the workout that CrossFit HQ has put out. So people will use the term main site. WOD, not a CrossFit exclusive term, but stands for workout of the day. A box is referencing the gym. Some people will call it their gym, but the box is what the term was because they all look like just big boxes for the most part, at least the way that they were originally in these industrial areas or their garage. Going RX. Going RX references, did you do the workout as it was written, specified on the whiteboard, or however it was instructed to? Okay? So people might have to do modifications, which they should, but oftentimes you might hear people talking about doing something RX. An AMRAP stands for as many reps as possible or as many rounds as possible, depending upon what the particular workout had. An EMOM stands for every minute on the minutes. So there might be a particular movement, it's a 10-minute EMOM. You do this movement on the odds, this movement on the evens, or you might just have a 10-minute EMOM and you're just doing that one lift, okay, for 10 minutes. Only once per minute though. The CrossFit Open, regionals, and the games. So I touched on this briefly. I'll go into a little bit more detail. The CrossFit Open starts, okay, and what people have had the opportunity to do is go online, develop a profile, pay your $20, $10, and then you're all entered into the Open. Every week, CrossFit will announce the workout. That announces on a Thursday evening, or at least that's the format they had this year. It was on a Thursday evening. You had from Thursday evening, from when the announcement was made, till Monday evening at 5 p.m. to do that particular workout. Then you recorded your score, and you entered it into the computer, okay? And then that ranked you throughout the world and within your particular region. If you're an elite level athlete or a potential regionals level athlete, they're asking you to video record for confirmation because they might pull that actual video to confirm that you did it if you've been invited to regionals. The top 48 in your region are invited to a regionals workout. That's over 3 days. This, for us, the Northwest one is May 17th through the 19th. Over 3 days, they're going to go through a series of different workouts again, and the top 3 male, top 3 female athletes will be invited to Carson, California for the games. And this is happening throughout the world, and they're going to be happening on different dates as far as regionals is concerned. And then the games down in Carson, California in the summer will kind of go through similar format, 4 days, I believe, Thursday, Friday, Saturday, Sunday. And they're going to have announcements for the workouts to determine the fittest man and fittest woman. There's masters levels, so between 40 and 45, I believe, and 45 up to 50 and then greater, and they have teams. Okay, that all will go through similar formats. Masters are a little bit different this year, but for the most part, this is kind of how they move from us just being local athletes all the way to being on ESPN. Okay? So, within the lingo, there's going to be things that we're going to talk about as far as like our benchmark workouts. There are the girls, and then there are hero workouts. This one here is called Murph, hero workout. Okay? So the hero workouts are based upon a fallen soldier, fallen police, or firefighter, and they have certain criteria that you have to meet. Murph is one of the more notorious ones. We'll run a mile, 100 pull-ups, 200 push-ups, 300 squats, then you go run a mile again. If you have a 30-pound pack, you should run it with a 30-pound pack, as it's written. The girl workouts, we've got a couple listed over there. I'll talk about that in a second. And then the CrossFit Total. So strict press, deadlift, squat. It's just another benchmark to see where you're at within certain aspects of your strength. So popular girl workout that a lot of people will talk about, what's your Fran time, is 21:15:9 of a thruster to pull-up. And a thruster is a squat to overhead press, and then regular pull-up or kipping pull-up for time. So you have to do 21 thrusters, 21 pull-ups, 15, 15, 9, 9. Karen is just 150 wall ball shots. For women, it's a 10 or a 9-foot mark. For men, it's a 10-foot mark. And then JT is another one, handstand push-ups, rings, and then regular push-ups for time. Okay. So some of the common implements, we talked a little bit about the wall ball shot. So a wall ball, they can be varying in degrees. It's just a giant medicine ball. Sometimes they're a little bit smaller, depending, but the wall ball is traditionally like a medicine ball size. 14 pounds is the typical RX weight for women. 20 pounds is typical RX weight for men. You might see sandbags being used, plyo boxes or wooden boxes for jump ups or step ups. Pull-up bars, oftentimes, they're going to be in a large span, so they call them a rig sometimes. Gymnastics rings are often used. Ropes for rope climb or for pulling. Sleds. Aerodyne bike, you guys remember these? The fan in the middle? I thought they were POSs. I didn't like those at all back when I was using them in college, and they're like a staple in CrossFit. It blows my mind. And the vast majority of them are pieces of crap, and they fall apart all the time. So there's some companies that are trying to develop. We have an assault bike in our gym, and it's like really durable and big and heavy, but I just find it to be the oddest thing to use this really old school piece. But anyways, a GHD is what this glute ham developer is often referred to, GHD. Concept rower, a rowing machine. You got your Olympic lifting bars, rubber plates so that we can drop our weights and yell and be happy. Kettlebells, and then PVC pipes. Okay. Commonly used gear. So, gentleman here has got a ton of it on, which is great for talk. Wrist straps. These are some Rebound knee sleeves. He's got his Oli shoes on, his Olympic lifting shoes. These are the bumper plates I was talking about. So those are 45 pounds, but they are designed to actually be dropped intentionally over and over and over again. So wrist wraps, Oli shoes, or Olympic lifting shoes, which is just an elevated heel, gives you a little bit of a mechanical advantage depending upon the lift that you're doing. You'll see people obviously wearing weight belts, gloves. Gymnastics wraps to help prevent tears. So if you guys aren't familiar with that, sometimes it's just a simple little leather strap that comes down through here and it's secured to the wrist. It's pretty useful when you're doing some of the high volume, high repetition stuff that comes up. Knee sleeves like he has, and then this is something I added in and won't be on the slides that you have, rock tape. Just kinesiology tape. But rock tape has cornered the CrossFit world, CrossFit market. So you'll hear a lot of people talking about use of rock tape. That's what I do a lot of when I go to these events. They're just like, I need you to tape my shoulder, tape my back, tape whatever, because it's magical and it makes them lift better, so they're going to use it. Not always, but it can be helpful. All right? So that's the lingo. Questions on lingo? You guys heard anything else that I haven't talked about that's pretty entertaining? I tease, but I would tease my fellow CrossFitters just the same. These are the conversations we have. I think when you get in and you talk more and more with certain types of CrossFit athletes, we also chuckle at some of the things because I think there's some silliness in the whole bit too. Yes, Clint?
Are you going to touch on concentric versus eccentric overloading?
So beyond the scope of this, Clint. No, I won't, and the purpose of is because the loading strategies that are being used are very independent to each individual box. I mean, we can go back and we can look at, different types of data looking at the load and things like that, but I didn't really want to touch on that because I don't have any really great data about CrossFit concepts and its applicability and its application and looking at these force transference and stuff like that. It's obviously something that should be looked at, or it can be looked at, but that's not something that I brought on. Okay, good.
Average cost per cert one?
It's not average, it's standard. $1,000? No. So ain't cheap, and it's always sold out at $50. And if you go on CrossFit main site and you look at all the different locations that they're running, that is a moneymaker for them. It's huge, constantly being sold out. And then all these additional certs. Not all the additional certs are $1,000. They're varying in degrees. But yeah, so a lot of CrossFit trainers are being spit out. Okay? So we'll talk a little bit about common movements that we get and we see within CrossFit. So the kip. The kip is the use of rapid hip flexion to hip extension to generate a moment of weightlessness or assistance, whether it's going to be a pull-up, a muscle-up, which I'll show in a second, a handstand push-up, but you're using a little bit of that energy of the hip motion to give you a little bit of an assistance to get into that position, okay? So some of the potential drawbacks, as this is taught to the level 1 cert, is if I don't have good shoulder integrity to even do a strict or to suspend from the bar, and I now add additional load because I'm going to get my entire body weight behind that because I kipped, because I got up to the bar and I got my chin up, then when I come back down, I have to absorb all of that load and potentially have a problem. So this is where I would have a little bit of a beef with the way in which we're instructing some things day one, and a lot of coaches know that. They don't let people go and run and do heavy-duty kipping anything unless they've demonstrated competency and capacity within stricts, okay, or a strict movement, a strict pull-up, a strict ring row, a strict dip, before they're going to do something more advanced. The infamous muscle up. So she's starting here, suspended from the rings. She's using that swing that she'll then apply the kip. She kind of gets into this little L sit. She rapidly sits up over the top. She's going to dip, basically press down, and gets herself into this vertical position. Okay, so that's the muscle up. This can be performed on a bar. She's doing a ring muscle up, but this can also be performed and commonly performed on a bar.
So when she goes at the top, are you like ensuring that she's like depressing her shoulders down away from her ears?
I'm making sure she's getting the best time possible. Go faster. No, I am. I'm teasing you. Yes. I'm making sure this is a pretty advanced movement. So if I had any concerns about maybe some structural integrity stuff, this is IMO time, in my opinion time, right? This is not coming from CrossFit. I wouldn't put anybody in that situation if they aren't demonstrating certain levels of competency within the shoulder girdle. So she would need to go through a progression. My gym does this, where they have to show a pull-up progression and be able to do 10 to 15 pull-ups and dip and pressing progressions before they would even put them on her rings to teach them a kip or to even ask them to try a muscle up. But absolutely. And then the thing that we have to think about too is where's fatigue setting in? Okay, where are these other types of things that are going on? Because it's oftentimes, a muscle up might be paired with another movement. She could be getting tired. So are we asking her to pull back a little bit, take a breath before she gets back on the rings? Those types of things. And those are all coaching cues that you might have to give, or that might be given by one of the instructors.
And like an engineer is going to know that.
Well, no, but not everybody that does the cert is an engineer. Right, but that was one of the things that I said, that you're getting people going through the 2-day certification process that might not have some of the background. But at the same time, they talk about this in the cert. We talk about ways in which we're progressing or regressing somebody within their specific movements. So it's not just like, hey, they need to be able to do muscle ups, and they need to be able to do this, and they need to be able to get that weight over their head. It's like, here's some movements that we have, and then here would be for maybe some advanced people. And then here's how we would take it back. And here's how you can work on those subsystems that might not be moving very well, whether it's a strength or a motor programming error or a stability mobility issue, so that they can get in those.
Overcompensating with other muscles because something's super weak,
Sure, absolutely. No, you're absolutely right. You're absolutely right. I would say that the vast majority of the people that are doing the level 1 cert, though, aren't engineers. But I'm just saying that you can come from varying backgrounds as you're coming to get your cert, right? Good question. Any other questions on that? Clean and jerk, very basic Olympic movement. Not always going to be doing the jerk portion, which is the pressing over the head portion. You might just be doing the clean portion. She's demonstrating here what is called the squat clean. Some people might finish in this particular standing up, more upright position. We call that a power clean. Okay? Sometimes we'll just do this movement all by itself, just the jerk, pulling it off of a rack, or actually having to clean it, but not do a squat clean, but then we're doing jerks. Another Olympic lift, the snatch. You can go to the full squat snatch, or somebody can catch it in a more upright position here, and we call that a power snatch. Or it's called a power snatch, not we don't own it. Handstand push-ups. So she's demonstrating, there's a pad here, her hands are here, so she's basically getting her head to drop down, touch the pad, she pushes back up. And then this is the use of the kip, and a kipping handstand push-up. Using the knees to bend down as she rapidly extends her hips. She's going to use that momentum and that energy to help her lock out and get her arms up. Wall balls and double unders, squat below parallel, or basically your hip crease needs to come in line, or be at parallel. And targets, like I said, 10 feet for men, about 9 feet for women. And then double unders. The ropes passes double twice, and can be triples too. Kettlebell swings. This is traditionally how we see kettlebells being taught in a lot of kettlebell certs. This is traditionally how you see kettlebells being swung in in CrossFit competitions or in particular workouts. So the difference is called American versus Russian. Russians would be to eye chin level, and then vertical is what we call the American swing. Pistols and box jumps. Pistol alignment through here has to have obviously a certain amount of ankle mobility, midline stabilization, hip and knee mobility, and then the box jumps. And they can go to varying heights depending upon the workout. And then the famous burpee. Oops. Right? So from an upright position, down to your belly, chest and stomach touch the floor, get up, stand up, and go again. Okay? Those are common movements. And there's lots more. There's lots more. But those are some of the things that you'll typically hear people talking about that come up in workouts. Good? Questions on the workouts, the movements? Awesome.
So when you're doing that,
Yeah.
like a burpee,
Yeah.
I'm thinking of boot camp, that kind of stuff. I mean, I've been injured a lot in boot camp as a therapist. It's because they're like, more, pushing, and you just keep going, and you're sagging, and your form changes. So how many people are you working with at one time?
Each gym will be different. I'll use my gym as an example. They cap all their classes at 15 because it's one coach. Yeah. Some places might exceed that. It's going to be, again, space dependent. Some places can't have 15 people in it. They can only hold 10.
That, like, so when their form starts to deteriorate, like, you might want to pump that out to the person because the person's going to be pushing them.
Yeah, you'll give them cues. Don't snake up off the floor.
Yeah.
You need to change it a little bit with a different position with your hands and your knees. Don't try getting up all in one motion. Walk your knees up to walk yourself to a standing position. So there are cues, verbal cues that you would give to somebody to try and correct that, absolutely. But just the same as we would see maybe in CrossFit, as we would see in any personal training studio. Maybe even if they do have a great background like a physical therapist, you can still see some of these fundamental flaws occur. So that's part of the challenge is looking at, how are we going to be able to just be better at educating those people that are the ones that are training and things like that, to be able to see those things, or to understand what is a progressive load to that area of the body, whether it's the spine or the knee, going to be like over time. And it doesn't always guarantee that there's going to be an injury, but we have to respect the fact that that's abnormal and that you're teetering a little bit on the cusp of something. So here's a way in which you can digress that or give them a modification. Okay, and that's coming up, which is what we're going to talk about. Yes, sir.
Is there a screening process before you let somebody into CrossFit that occurs?
And that is very specific to each individual box. The vast majority of gyms run what they call an onboard process, or a jumpstart program is what we term it at my particular gym. And that's a 4-week period of time where they go through a modified FMS, something that actually one of the head coaches has developed. It uses a lot of movement screening techniques to look at short rectus, short heels, thoracic mobility, shoulder mobility, not diagnosing, but looking, do you have adequate mobility to even put your arms overhead into that push, press, or jerk, or for a pull-up, and trying to correct a little bit of those. So they give them correctives, and then at the same time they take them through a much more fundamental approach to the basic movements within CrossFit. So they'll show them how to row effectively. They'll show them how to do a deadlift effectively in a very, very individualized manner. It's capped at 6. One coach, 6 people. So they go through and they have a chance to work with them in great detail. So they do, and a lot more are doing this, because it's hard enough to herd all of these cats together and make them do a workout sometimes, just because there's a lot of implements, there's a lot of commotion, and you've got 2 or 3 newbies in there. It's going to be very challenging. So a lot of places are saying, hey, we need to get these people on board better. At least the affiliates that I've been in contact with and that I collaborate with, every single one of them has some level of an onboard process. Okay. So I'll go through some of the common injuries that I see and that I treat both in my clinic and that I end up actually doing triaging for when I see them kind of at these comps. This is obviously something that we would see in a variety of ways. He's doing this intentionally. This was for a demo, but you see that with people that are thinking that they're doing fine, right? So he's trying to perform this deadlift, but he's got an extremely rounded lumbar spine. So looking at components of that, poor midline control, shoulders, they're going to have a lot of hypermobility. So we get some former gymnasts that come in that haven't been doing gymnastics for a while, but still have all of their excessive mobility, but they don't have their neuromuscular control back online like they used to, and now they're back on the rings. So some things that might come up with that. Next can get into some poor positioning. You can get a lot of that hinging when they're doing their kettlebell swings and they're tilting their head up every time they drop that bell down. They're doing this and they're doing this, and they walk away and their necks are sore. Or they don't have adequate control when they're doing their handstand push-ups and they're in that vertically loaded position, which we know the cervical spine's not designed for that much load, and things can happen, okay? Nothing too terribly serious, but obviously people can get sore and stiff from stuff like that. Hands. Did an event 2 weekends ago, and the movement destroyed 90% of the people that were there. It was like wound care 101 with scissors and tweezers and a lot of hydrogen peroxide, because the volume was so excessive. These were very seasoned athletes that just got beat up in a particular movement, and I think they weren't comfortable with one of the movements because it was relatively new, and their hands got a little bit beat up. But hands do come up quite often. Not that you guys might not be dealing with that a lot in the clinic, but people also like taking pictures of their hands and throwing up on Facebook and seeing how cool it is that their hands got torn up during a particular workout. You got to pay to play, as one of my buddies put. Knees, we know about knees just from an orthopedic standpoint, about some of the other risks within other sports, soccer being one of them, female knees and valgus. But we can also see this. Imagine now that she was doing repetitive box jumps, or imagine if she had an actual load across her shoulders in a squats, something like that. Calf and Achilles, again, going back to a little bit of the box jumps. Some people will adopt a technique called rebounding, where they'll jump up to the box, they'll jump off of the box, and then without pausing at the bottom, rebound right back up to the box. Ton of load on the gastrosoleus complex and the Achilles tendon itself. I've actually witnessed a rupture last year at CrossFit Regionals, high level competitive athlete, and she was doing rebounding, and sure enough, she had snapped her Achilles. So something to take into consideration as well. My friend Lou and her funky elbow. So she has a little bit of elbow problems along with right shoulder problems, but looking at people that have hypermobility and now they're having lots of load overhead, could be some potential issues. And then again, not to get into the details of rhabdomyolysis, but we've all heard of it, rhabdo, right? So it can happen. Obviously, we're looking at lots of load. We're looking at relatively new people, or even relatively well-seasoned athletes can still get it from looking at volumes and loads and intensity levels combined with other variables and other factors. It is a very, very low risk and likelihood, but it does happen, so it's worth noting, okay? And when we kind of get into a little bit about where we can intervene and where we can help, we'll be able to talk about components of hydration, nutrition, supplementation that might be able to help people avoid anything like that coming up. So, components of the common injuries, it's pretty vast. It's no different than we would see within into any other sports, okay? What we're looking at, though, within aspects of CrossFit is that there are implements that can add excessive loads in a very, very short amount of time. Compared to a runner who's adding load over maybe a longer period of time, this can happen quite rapidly with some of the things within CrossFit. So I think the number one, this is in my opinion, number one reason is physical baggage. People are coming to CrossFit, or they're coming into, let's just say, exercise with pre-existing things that put them at a higher inherent level of risk. Everything worth doing in life is going to carry a certain level of inherent risk. If you're coming in with stiffness in a shoulder from something that happened 15 years ago and you've never really addressed it, or you've thought you've addressed it, and now you want to go do something more physically active, even if it is or is not CrossFit, you have a higher risk, maybe. Other things too can coincide with that. So I think the physical baggage part of it is where we see a lot of people having problems. And then in conjunction with that is going to be stability, motor control issues, those types of things. No different than what we would see in the common athlete coming in. We're trying to identify, why is it that you have this chronic ankle sprain? Why do you have this issue with your shoulder and these overhead movements? So we're looking at other variables that would be part of that equation. But then moving off of that, there are other areas. They're under-recovered. They're very unidirectional on a lot of the movement patterns that they do. Okay? Sagittal plane dominates the vast majority of the things that they're doing. So if these are our patients or these are our clients, getting them to understand that training in multiple directions of movement can maybe help reduce their relative risk. There's limited periodization, and this is a very general term. I'm not calling out CrossFit in general, but just looking at the fact that people might carry high levels of intensity over a very, very long periods of time. And so they're looking at progressive overload. And then this touches on what you were talking about. What happens when they start crapping out and they're failing and they're fatiguing? So failing to modify once fatigue sets in. So looking at somebody that's arching a ton in a front squat, really, really rounding over. And you walk over and can you ask them to take that weight off? So the challenge though is that the vast majority of these athletes that are in these gyms know better. They've been told what to do. They've been told what's expected of them from a movement and performance standpoint. But egos don't get checked at the door. That's not RX. I'm supposed to be swinging 53 pounds. Why would I take 42? So those types of things happen. And that's just human error. And those are the same things that we'll see regardless of what we're talking about. This could be a conversation about running. This could be a conversation about being a triathlete. So people understand that there are inherent risks, and what's happening is that some people are just not taking that time to look a little bit more inside and say, hey, you know what, I really shouldn't be at this level, or I shouldn't be doing that. And the coaches will be there. They do a really good job of that, the vast majority of them. Okay? And then we all know about regional interdependence.
So is there a component, like a meditative component, or like teach them to go internal? And I mean, it sounds like it's all physical, but you also need to like rest your mind and your body. Like
Some do. Some CrossFit San Francisco, I'll use an example because they posted a lot about yoga. They don't make you do yoga before you go do your CrossFit workouts, but they integrate it. They have that as an integrated part. So there are other things in which they will bring in to, because people are like, I've got to go to CrossFit, or I've got to go to the gym. Let's just say gym, for instance. Other CrossFits, other boxes will actually have these things hosted there intentionally so that you have to take a break. You have to do something different. Where there are no classes today, it's only this yoga or this meditation or whatever. And that's going to be very gym specific, demographic specific. So you have to understand that you're going to find that you're going to go into a gym, you're going to go into a box, and it's highly competitive. It's got a lot of phenomenal athletes that might be competing at a very high level, doing a lot of weekend events where they're competing pretty consistently. Maybe there's a whole handful of regional level athletes and one, maybe two that can make it down to the games. But that's gym to gym specific. My gym is not like that. We have a very different atmosphere. We work hard, we love what we do, but we're not at that level. And then some other gyms are kind of a hybrid of that. And so that's another thing when we talk about, how do we get people in the right environment, they also have to just fit in and feel comfortable. So while that doesn't have anything to do with the coaching or anything to do with performance standards, that also has to do a lot with the psychology behind what they're doing and why they're doing it. And that's something to take into consideration too. It's a little bit different than what you're asking. But as far as looking more introspectively about what I'm doing, some of the things that I've seen coaches do is that as they start loading up the bars and they start preparing for the workouts, they'll be checking them in their warm-ups and being like, you can't go any past this. This is it. You're done, right? Don't load anymore here. Or they'll chant, and this happened either today or yesterday, I can't remember when he said it, but he basically said, if I see you doing X or Y, and this was basically looking at poor performance, I will come over and I will strip down your bar. So they'll take the weights off for them. And I think that's just being a good coach and being able to call them out and say, no, that's not right. And for the vast majority of the people that I train with, don't have egos that get bruised with stuff like that. It's like, hey, thanks, I didn't really see that. Kind of a thing, right? But hopefully over time, as these athletes perform it more and more and get better and better, I have identifiable weaknesses, say poor posterior chain activation, that they get some of that individual programming, or they take 5 to 10 minutes extra before they get there to work on their mobility issues. Or they come in on a day that's their recovery day and they do a little bit of core midline stabilization and a little bit of stretching. So it's not about calling out the gym and saying, why are you doing this and why are you doing that? Because oftentimes they are doing, I think, a pretty effective job of giving people the tools to make themselves better. But no different than what you and I deal with in the clinic of trying to get somebody to run their home program to get better, people will do the same thing. They might roll in 5 minutes before the workout starts, they'll swing the rope around, they'll go through the workout or the warm-up that's prescribed, but they might not ever be tapping into the individual things they need to be doing. And when you're dealing with volume and you're dealing with numbers and you're not dealing with an individual one-on-one personal training session, it's really, really hard to take that time to focus and tailor everything to each individual that comes walking in, especially 15 deep. Right? Good point, though. Good question.
You just said prescribed movement.
Yeah.
So I'm thinking about the incident that happened where the high-level athlete was left with spinal cord injury.
Yep.
He was prescribed by his coach to warm up at a specific weight.
Uh-huh.
And that was where it was at.
Right.
So do you feel like the variation between coaches' background, kind of like what this gal was talking about, is a risk? Especially if they're trying to take it to like the games and the regionals and the world,
Sure.
and it's like, well, if we're not standardizing.
But would you standardize, or do you feel that an elite level athlete would fall within the ability to have a standardized program that would fit his or her demands or needs or abilities? Do you see what I'm saying?
I see what you're saying.
Yeah,
I do.
that's the question. So I'll talk about this probably a little bit more, but more and more these elite level athletes carry an entourage. They carry an entourage of coaches that will help them be specifically trained metabolically, powerlifting, Olympic lifting. They'll have chiros, massage therapists, PTs, acupuncturists, voodoo doctors if that's what they believe in. But they'll have those people with them, right? And so they're looking at tapping into a variety of resources to get themselves better. Kevin Ogars, who I think you're talking about, his situation was very unique. I've actually seen the video, and I don't know if they've ever come out and said specifically what happened. It's my belief his back broke under the load, and that's what severed his spinal cord, not anything about his fall. That's my belief. My thinking is that his spine was compromised well before that. And that was a load that he happened to do in that particular lift, from my understanding, is something that he's handled many times before. And he had actually intended to go much higher. So when looking at the video and looking at when he actually collapsed, my thinking is that was the point. That was literally the straw that broke the camel's back, and no pun intended, right? So thinking about that as a situation. But when we look at, let's just take, he's a 1%er for sure, total awesome high-level competitive athlete. But if we're going to take the vast majority of us, I think you can standardize certain aspects of the movement. But at the same time, the individualistic needs are going to vary from person to person. You might have a stiff T-spine that limits your arms coming overhead. It might be my ankle that I broke when I was 12 that doesn't let me get into my squat the way that I need to. But both of us suck at overhead squats. So we both can't be running the same thing. We might benefit from a little bit of T-spine mobility, and you might benefit from some ankle mobility, but my big hang-up is this, and your big hang-up is that. So I think it's good for the coaches to look at the workouts that are coming up and say, hey, we've got overhead squats, and we've got some kettlebell swings, and we're going to do some medicine ball, wall ball shots. Movement preparation into those patterns a little bit. And they do that. The good ones are doing that. They're looking and they're saying, hey, well, here's our movement prep for today. We have to go through this, 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 and this because it's adequately preparing our tissues, our neurological system to be able to move into these movements. But if you know you have a restriction from your T-spine, and I know I have a restriction on my ankle, I should have been here 10 minutes earlier doing my homework or doing what I need to do to prepare well for my particular event. Make sense? Okay. Does that answer your question, though, too, or your statement? Okay, good. Yes, sir.
One of the problems I have with the CrossFit thing is you're saying, well, the good ones do this. They're cranking out how many people? This certification basically seems like a money generator for people that do the certification. And there's probably good ones, but how many of people out there are not good ones?
I don't have the data.
You know, it seems very kind of helter-skelter and uncontrolled. I did a competitive Olympic lifting way before these people thought about it.
Uh-huh.
And it was very scientific. Period, we had periodization, and we worked at it. This, to me, just seems real scattered. And I know there's some good things to it. I mean, I love the movements, but it just seems a little bit kind of, a little bit too much machoism to it. You know, rural exercise. I find that.
Should. Do you know how they termed it?
I have no idea, but I don't like the way it sounds.
It's fairly offensive how they termed it. You guys want to hear it?
Yeah.
Just don't get mad at me. Anything that leaves you on the floor in a heap crying should be named after a woman.
Oh my God.
That's bullshit.
Show it.
To be quite honest with you.
So let's think about it this way. 1995, this all started. It started in a garage with some dudes hanging out, exercising, and really enjoying the exercises and the camaraderie that they had. Over time, it's manifested into something much bigger than that, the Juggernaut, okay? So in that sense, CrossFit is an easy one to pick on, but the industry of fitness and health and wellness, it's just the same.
I don't think it's the same.
Well, I think we can have a good drink and talk about this, but when you look at the regulating bodies of other things, just like this, you're going to be getting, when you start dealing with masses and things like that, you're going to be getting people that are going to be having wide variety as far as levels of expertise, background information, and applicability. I think as a whole, when you look at the concepts that CrossFit is coming up with in development and the way in which they're looking at actually getting people to do certain things as far as from fitness, health, and wellness, they're doing a pretty good job. They're not perfect by any stretch of the imagination, and they know that, but they're trying to get it better. And for us to sit here and to pick on it a little bit and say, because you have X amount of trainers coming out, I don't think it's necessarily a fair argument, because we could just as easily pull some data about personal training institutes that are pulling out probably just as many personal trainers that have just the same ability to put people in the same exact environment. Because you and I could go be a personal trainer and run main site workouts. We'll call it CrossFit. We can't publicize it for some legal purposes, but we can still do that. I agree with your arguments, though. I think you're absolutely right.
I mean, I think the movements are great. I mean, it's
Sure.
really good stuff. But I just think it's a component to it, the whole kind of, oh, look at my hand thing. I mean, that to me just makes no sense.
But you'll deal with that with runners too. That'll pull off their shoes and be like, "Dude, you should see this blister I got. You see this toe? It's black. It's falling off." I mean, and I'm being silly for a reason but that's how we deal with sometimes when we deal with getting into environments where we're having people active the way that they are. Particularly when we deal with athletes. I think even more so when we deal with human beings. Just humans are just really weird creatures. So this type of stuff can come up and they can be fanatical about what they do, and it's important, I think, for them to actually bond with it and gravitate towards it, but in a very healthy way, right? I mean, if I tear my hand, I don't be like, oh, cool, I'm going to go put this on Facebook. Somebody might. Doesn't mean there's anything wrong with them. I think about it like, crap, now I have to kind of modify some training programs so that my hand can heal a little bit, if we use that as an example. But I mean, you bring up some very valid points, and the whole purpose of this was not for me to say, you guys have a piss-poor conception of what CrossFit is, this is what it is, and this is why we're great. The purpose was for me to sit here and say, these are the concepts that CrossFit puts out. And when we look at some of this, and we're not talking about it in comparison to anything else, but when we look at this, it's not really that radically different than some of the other things that we might see come through our door from a different arena. So but at the same time, we're going to get into some good stuff, and it's good that you brought this up, because now we can talk a little bit about making it better. Yeah?
I guess the one thing that kind of drives me crazy as a certified running coach is that I treated every athlete as an individual.
Mm-hmm.
Like the workout of the day, should
Yep.
everybody be doing the same thing
Right.
on that day?
Yeah. So that would be a little different if you had individualized goals, though, too. Like, you could probably take a handful of people, and please correct me if I'm wrong, but you can probably take a good group of people and say, couch to 5K, and we can maybe give you guys all general running concepts of programming, about what you need to do over these next 6 months to get you to that goal, and have it be the different workouts at different points in time with your rest periods and stuff like that for a very generalized group. But then some people are going to be like, hey, you know what? I want to be serious about this. I would like to do a marathon, or I would like to go do this particular triathlon, so I need to talk to my coach. And that's where some athletes are going to, and that's kind of like that entourage thing that I talked about. Athletes go and they talk to their coaches, or they find coaches online that can program for them. And they'll find somebody that maybe programs really, really well for their Olympic lifting, and they get some Olympic lifting coaching. Or they'll go get some coaching on how to improve their metabolic performance, because the high endurance Metcon type stuff is really wiping them out. So for people that are coming in for just generalized fitness, it's kind of like a boot camp class, right? So that's, I mean, in a very general way to put it. It just uses different implements, or you might not see some of an Olympic lift in a boot camp class, which can be part of the problem too, because it's pretty complex, those Olympic lifts, right? But that's where it can kind of teeter back and forth. For the masses, or for maybe some general people, they can probably get some pretty good benefit from it. Does that? Pardon me, go ahead.
So the other thing to think about though too is when CrossFit is addressing all of these different areas, endurance and strength and power, the workout of the day is going to be focused on very different things from day to day. So there's going to be days where it's very long and endurance based, there's days where it's very short and strength based. So everybody going in is going to have things that they're relatively stronger at doing, better at doing, or not as good at doing. So you're going to work on your strengths and your weaknesses and the things that you're doing. So it's actually, you don't get to pick, I'm going to do the things that I like. You're going to have to do the things that you don't like as well. So that's not the issue. But it's just the specifying that you have to do so many or you have to do this much more. It's a goal. Putting that across, but it's a goal. I mean, people look at that and I think they go for, well, do it.
But then again, it would be helpful, and you're hoping that the coaches would be there to say, hey, you know what, for you, you're not RX today. And like, you know,
That's all you're hoping.
sure. But just the same as if they're working out at 24-hour fitness and I just rehab them through their post-op shoulder, I would hope that when they got with that trainer, they would have a conversation, and that trainer would be doing something competent to be looking at. And I'm not picking on the fitness industry, I'm just using it as an example. But I would be hoping that whatever they went to do, yoga, Pilates, personal training.
How long is the certification for a personal trainer compared to what's certified?
I can go online right now and I'll be done by the time we hit the pub. I mean, you can go online and get certified. But you and I can also sit there and be good and charismatic and have great interpersonal skills. And we can call ourselves wellness coaches too. So when we're looking at an industry that has less regulation than what you and I are used to dealing with, that's where some of the challenges can come with. But don't get me wrong, and I'm not going to poo-poo my profession because I love this profession, but we have a pretty stringent process of becoming good physical therapists. But we could just as easily see really crappy physical therapists out there too, and we have a really, really hard time getting to where we are to be able to practice the way we want to practice. So, yeah. You and I need to go have a drink.
If I can make a comment, you
Yeah.
have pointed out several times that the elite level athletes who are part of the community seek out those coaches which are that specialize in very specific activities. And if you look at the fitness industry in general, that's actually the current model, particularly for mixed martial arts.
Mm-hmm.
You know, because you can't go to one trainer and get everything you need to effectively compete in the ring at an international level.
Certainly.
So that I really support the idea of going to seek those individual coaches if you're going to an athlete level.
Mm-hmm.
But there's a lot of people, and I've treated a number of them who end up in the box as a way to stay fit for themselves. And what I find is really pertinent with the last lecture that we had is just that when you pick those people up because they've had an injury, it's our responsibility to analyze their movements and do the best that we can to prepare them to go back into the box.
I wish my next slide was talking about better ways to collaborate, 'cause that's one of the things. I mean, very well said, and we'll touch on that most in a second. Were there any other questions or comments? This is good. This was the purpose. Not to get drunk and have lots of drinks and come first, but it was definitely to talk.
Thanks, Josh.
Yeah.
This is a great presentation.
It's not over.
I wanted to know more about.
Yeah.
My interaction is with another PT.
Yeah.
Who's also a CrossFit coach. And
Yeah.
I learned a lot from her. But a lot of the conversations we've had is that, and the patients that I've had, I have probably 3 dozen CrossFit injury patients. That's been tapering over the last year. But a lot of what I feel like I do for them specifically is teach them that more is not better, better is better.
Hmm?
And I think my friend who's the coach incorporates that into her teaching. She's
I know who you're talking about.
She's in a different town, but
Yeah, I know who she is.
they don't have the same fallout rate that
Yeah.
my local box does.
Yeah.
So it's nice to be able to appreciate
Right.
a little bit some of the dogma involved in the background. Is nice.
Totally. I'm going to fly through these 2 slides. These were specific things that I had posted on Facebook to CrossFit athletes that just know me or follow me and things like that. So these were some of the things that they had asked. I said, hey, what do you guys want? What would you want me to present? Because when I was asked to do this, I really didn't have a format or have a thought of how to talk about CrossFit without it probably being my bias versus what's the research out there or whatever. So these were some things that they specifically put in there. And you guys can read those and hopefully you have the slides a little bit. But the reason why I want to move through these is because I think it's going to help us to kind of talk about this, right, where we fit in, because this is kind of where our conversation is just naturally gravitating towards. And again, this is my bias a little bit, but these are just some of the things that I think are helpful for us to think about while we might have concerns about the way in which the programming is being done in a particular box, or we have concerns with some of the movements that so-and-so is going to be asked to perform. Some of the things that we can do to kind of intervene and collaboration. I know that the chiropractic profession and us, and we haven't always seen eye to eye in a lot of states, but I've collaborated really with some phenomenal chiropractors in CrossFit and just in general, and the conversations that we're having. They're probably less traditional than what we would normally call a chiropractor, but they're doing a great job. But also having massage therapists, body workers, and coaches. Again, we can develop our own little entourage of people that we would have as resources back and forth, people that we would see at events, or people that we can communicate with because maybe that athlete is going somewhere else. I think we also fit in when we're doing the assessment process. We can be looking at it from an acute standpoint of you talk about patients are going to be coming into our clinic, and we need to look at them from an acute standpoint. But then at the same time, what if they've got that physical baggage and there's concern? So, some coaches will actually call me and say, hey, so-and-so had an old knee injury. Can you just make sure they're appropriate to be here? Or the patient will come in and say, hey, I've had this hip issue for umpteen years. I really like what CrossFit does, or I've had fun here, but I'm just concerned that it might be a problem down the road. So again, some people are starting to take more note of it. And then, as you commented, it's not just about the recovery process. It's not just about getting them back to their prior level of function, because the prior level of function might not be enough for where they want to be. So looking at that continuum of return to sport and getting them into environments, whether it's within your facility or collaborating with the coaches, to kind of test them, no different than we would test any other athlete, post ACL or something of that matter. We're not just going to send them back out after they've obtained a certain level of range of motion within their knee. We have to understand their capacity to be able to withstand what they're going to be withstanding. So this is where we really fit in, this education part. Clint touched on this very, very well. We need to be the ones out there educating, or if we have the knowledge and the ability to, we should be the ones out there educating, talking about whether it's going to be a modification to a particular lift. I think one of the hardest things that CrossFitters deal with is being told they can't go back to CrossFit because squatting to parallel brings on that pinch in their hip. But maybe they can squat a quarter depth, or they can do something slightly different. Instead of doing the overhead work that hurts their shoulder, maybe they can do a little bit something that's part of the rehab process but also keeps them within that particular workout of the day, and touching on that with them. Okay? Looking at giving them the specifics of what they need to be working on. What are their self-correctives? Maybe they're not injured, but you're noticing something from your screening tool, your FMS, your SFMA, whatever you happen to use, and seeing that they have some issues, and you can start helping them develop those correctives that they come in 5, 10, 15 minutes early or later, after the workout and work on, okay? And then looking at the progressive return to full participation and making sure that it's personalized. Because the internet obviously is ripe with crap. And a lot of information that comes through the internet is stuff that people are just touting it well, and they've got a great Facebook page and they've got a lot of people that follow them. We can be the ones that are giving them probably the best level of information, or collaborating with their coach to give the coach the best level of information. So being able to deal with somebody that has a background in Olympic lifting and then being able to take that to a gym would be huge. Because some of these coaches don't have that. They've gone through maybe a certification, or they're pulling stuff off of the internet and they're trying to read stuff, but it would be fantastic. Develop a workshop. I've done a couple of workshops on specific joint regions and things like that for different gyms. And then just most importantly, being that resource for your community, okay? So then these are my final thoughts. Knowledge is power. Our knowledge, understanding more about what they're doing, is powerful for us, because then we can turn around and empower them. These athletes do need our help. They're not falling apart. They're not the worst things in the world. We can see this in a lot of different sports. But they need our help, coaches too, in the sense of we have a lot of information that maybe they don't have, or maybe they have a lot of information that we don't have, and being able to kind of collaborate and find each other midway, okay? So I would encourage you that depending upon where you are, your geographic location, if it's convenient, or you're seeing more people coming from a particular gym, go there, observe a class or two, have a conversation. That's how I've met the vast majority of the coaches that I've met here. I just went out, I introduced myself, and said, let me know how I can support and help you. I landed on CrossFit Portland because of a variety of reasons. One of them, I think they've got some phenomenal programming. It's close to my house, and I really jive well with the coaches. But at the same time, we kind of banter back and forth, and we have really good working relationship because it was just me being there and being a resource and being as helpful as possible, okay? So we haven't answered this. Maybe we have, maybe we haven't. But I think it's important that we understand that CrossFit is what it is to that individual. And so for the CrossFitter that goes and has yoga that's also offered there, maybe they don't identify with the fanatical CrossFitter who's doing crazy stuff that maybe we don't agree with. But at the same time, it still falls under the label of CrossFit, and we just have to understand that it is very unique and very individualized to each one of those individuals. Okay? Had good conversation, but are there any more questions?
Answer that question about, tell me about doing a squat. Why is it okay? That one.
If we go back, she's asking a question about, talk about how going below parallel in a squat is okay to do sometimes. Is it? Sure. Yeah. Sometimes, if they're appropriate for it, if they demonstrate the competency. Right.
Everybody's got baggage, so it's like, I mean.
But is your baggage that would limit you in your squat or make squatting something that could be potentially detrimental? What if your baggage is just show? Oh, you're helping them because you're collaborating with your coach. That's what it is.
I'm afraid to take this. Like,
What?
I was like, oh, everybody can do it.
Maybe I should have just had you guys all do a CrossFit workout, and then we were like, oh, I know what it is. So, no, the question came up because I've worked with this individual who posted the question, and I think at a previous time that she had met a clinician, they said don't go below parallel. And I don't think it was well-founded. And she does Olympic lifts, and she's a really good lifter. And she obviously, when we saw those pictures of the Olympic lifters, needs to break parallel for that. So that was just a statement that she wanted to be put out there. And I think we know that. It was her just kind of saying that. I hope that people understand that it's okay to go below parallel certain people at certain times. Sure, we know that.
Do you
Well,
promote that in your
yeah.
box? Like,
I don't know that.
promote people like to get below parallel all the time?
Not unless, it's not my box. I don't have a box.
Oh, I thought you said you
No. CrossFit Portland is where I train. Sorry, I just associate with it and call it we. No, it's if you can demonstrate parallel or below parallel, well, to parallel is typically what you have to do for it to be RX. That's also why parallel is brought up in this conversation. So when they do their wall ball shots, when they do their squats, front squat, back squat, they need to break parallel. But then when we're doing Olympic lifting, you don't always have to break parallel. But when you're getting to elite level status and you need to get under that bar fast, the least amount of distance that bar has got to travel and the faster you can get underneath it, the likelihood is that you're going to have to get in that really deep squat. So that's why it gets promoted.
This isn't moms and, homemakers. This is those elite people. Like, I couldn't come to a class tonight.
Absolutely, you could.
Well, I mean, not with those, but like.
We'll put them aside. No.
But, and you can do a girl workout. I could be crying. I definitely would be in a puddle crying for sure.
So don't get confused when I throw up Fran or I talk about Murph and the mile run and stuff like that, that it needs to be met at any particular period of time. So in this year's Open, 2 or 3 athletes throughout the country were highlighted because it took them an absorbent amount of time to do one of the workouts. Workouts that the elites, the CrossFit Games level athletes were doing in 8 minutes was taking people 53 minutes.
Yeah.
But they moved. They just moved comfortably through the workout, and they did it, and they finished it. And that was the accomplishment that was highlighted. It wasn't their time being god-awful or their movement standards or anything like that. They completed the workout as it was prescribed, and for them, it was tremendous. Okay? So the idea that you have to hit standards of time or of weight are irrelevant. There is going to be components more or less about movement that we would be focusing on, at least from us and our standpoint, looking at the movement standards that are being asked. So for some folks, the workout would not be a full squat. It would be the squat that they can do well and not compromise their bodies. Just the same as it might be a full squat or an RX squat. It's modifiable. You can tack on more, you can take away a lot. So it really has more versatility than I think it is perceived to have as far as the movements and the workouts. Does that make sense? You might not be RX. You might not be doing prescribed, and that's okay. You were there for 45 minutes and you got a workout in. So that's also a component of it.
Not like boot camp, like
They push you. They push you.
Oh, yeah. We'll ask you to do what's within your physical capacity to do it.
harder than boot camp.
Yeah, harder than boot camp, easier than yoga. I don't know. I mean, it's gonna have some standard of challenge for you, but it's very individualized. And that's the other thing that I have to understand is that while we'll walk up to a whiteboard and we'll see a workout written up, it's very individualized. 53 pounds for a kettlebell swing, not in my wheelhouse. 25, I've got that covered. I can do that, and I can do that for the amount of workouts. I can't do double unders because I just whip myself in the back with my jump rope. I'm doing singles. Okay? I can't do a full pull-up. I'm bringing out the rings, and I'm going to be in a little suspended position. I'm going to do ring rows. I did the workout. I did 21-15-9 ring rows instead of pull-ups. Does that make sense? So it's much more individualized, much more modifiable than we give it credit for. Okay? We'll get into trouble if you don't have the competency or the capacity to do any of these movements, and I'm yelling in your ear, get lower, get lower, get lower. That's where it becomes a problem,
That's how I
right?
broke my foot.
Somebody's yelling at you? CrossFit?
No.
See?
No, like, no, not
CrossFit.
Yes, I was in CrossFit.
Yeah, you would. So yeah, so it's very modifiable. Some mood lighting. It's all right. Nice. CrossFit After Dark. Any other questions, comments, or concerns? You guys are more than welcome. My contact information is on these slides. You're more than welcome, thanks Clint, to contact me. More questions, you're more than welcome to come hang out with me at a CrossFit workout, and you guys are more than welcome to bash me on the internet. So love you either way. All right, thank you guys.